Dr. Ronald Prehn. I'm a dentist in the Metro Houston area, and I have limited my practice to treating TMJ, orofacial pain, and dental sleep breathing disorders like sleep apnea. The purpose of this video is for two reasons. One is for patients to know that there is other options available for CPAP therapy and oral appliance therapy. And it's for medical professionals to know that for their patients there are other things available as well. The subject is going to be combination therapy. This is a therapy that was developed and invented by Dr. Keith Thornton up in Dallas, and I've had the opportunity in the recent years to be able to help him to get it FDA approved. The definition of combination therapy is a combination of two therapies. It's to combine CPAP therapy with this continuous positive airway pressure, combined with oral appliance therapy, such as this, to bring your jaw forward. When would you consider combination therapy? You'd want to combine them only when one or the other fails. You have to have failure of CPAP therapy, and you have to have failure of oral appliance therapy. And it also, this therapy features one particular thing. It's called mandibular stabilization. You're stabilizing the lower jaw, and that stabilizes the airway. So just connecting a CPAP machine to a splint isn't going to fit for this type of therapy. So when would you consider oral appliance therapy a failure? Well, when a patient has jaw joint problems or the teeth movement and they can't tolerate bringing their jaw forward, then you should start thinking about combination therapy. There are two types. Type 1 is something every dentist who's trained in oral appliance therapy can do right now today. And that is to make the patient a TAP appliance. Thornton anterior position appliance. This is the basis for combination therapy, as you will see in a minute. You make them a TAP, and you're bringing their jaw forward, and they can't tolerate it. So what you do at that point is put them back into a comfortable position, although slightly forward, and you combine it with the CPAP machine. So this is a combination of CPAP therapy and oral appliance therapy. Then the patient goes back and the physician retights the CPAP machine because you get to lower the pressure, and it's very well tolerated. In fact, they could probably get into a more comfortable type mask situation like nasal pillows or something. This is something that the physician will be managing. The physician will be doing everything with the CPAP machine, and dentist does not have to deal with that. The dentist just has to deal with all the aspects of oral appliance therapy as before, except without so many side effects. Very effective therapy, and something that can be done, like I say, tomorrow or today when as soon as you learn how to do it. Type 2 is a little bit more sophisticated. Type 2 is we are actually attaching the oral appliance therapy and the CPAP together as one unit. Why would we do this? Well, we would do this if the patient just can't tolerate any type of CPAP mask. Failure on CPAP masks, machines and therapy is about 51% nationwide, although some local physicians may be higher than that. The one here in Houston is much higher than that. But the failure of CPAP machine is usually the mask. So therefore, connecting the mask now is very simple. You buy, well, it's simple, but you have to learn how to do it. In other words, type 2 requires additional education and training to do. But once you learn how to do it, or at least you know this option is available, you are sent a kit. The kit is a post and a nasal pillow holder called a collet. And what you do is you screw the post onto the TAP mechanism that you've already made. That's why you need to have a TAP first. You screw it onto the TAP mechanism, then you glue the two upper and lower shells together with thermoplastic material, which you learn how to do. And then you connect the nasal pillows onto the post, turn it tight, and now you have the TAP PAP chair side, CS. Now you notice the jaw is stable, Brought forward a little bit. The nasal pillows are in the nose. Nothing is touching the face. Nothing at all. The only thing that's touching the face is at the nasal interface here. Very comfortable, very quiet. No leakage. The patient can turn on side to side, and it's all stable. It's connected to the skull base. Very well tolerated by patients, and bed partners particularly like this feature because it's very, very quiet. Now, CPAP machines go from 0 to 30 centimeter water pressure. Most machines are on 10 to 15. But if you get over 15 centimeter water pressure, what happens is you start to get mouth leakage. In other words, the pressure goes up the nose, down the back, and comes out the side. You get a like that. Well, that wakes the patient up and you start to lose effectiveness. So now we need to seal the mouth. What we do, we just unscrew the tap-pap mechanism. We put the shells in the mouth and we take an impression of the face. Pull the impression off. Pour it up in stone. I have the impression of the nose, the mouth, and I make a vestibule here. And I make a suck down off the biocryl, a couple layers, I build it up, and now we have a custom mask. The custom mask is developed to, or designed to seal all around the nose and the mouth. And that gets connected to the oral appliance aspect. It's completely sealed. Now, this is a very, very effective and compliant device because I have done some studies on this and showed 100% compliance. And interesting enough, the bed partners really love this as well because of how quiet it is. The other aspect of this that is interesting and an option that's available is that the pressure here goes into the nose and the mouth is sealed. But we can also cut a hole here and allow the air pressure to go into the mouth. So now we can share the pressure to the mouth and the nose. That's if the patient has nasal problems, they can't tolerate the pressure. That's one feature. The other feature is that we can actually cut off the mouth part and grab just the nose. Like that. Again, very comfortable. I made masks like this for somebody who's got trigeminal neuralgia and they couldn't tolerate anything touching their face. So that worked out very well too. So I hope this helps you as a patient not to give up hope that there is something else that can be done if you're not able to tolerate the standard CPAP machine or the oral appliance therapy. I hope this gives hope for the medical professionals out there, especially dentists, to know that what they are doing to help all these patients with oral appliance therapy, that if it's not successful, then there are other options available. So this may end up saving people's lives, and I hope you consider it for yourself. Thank you.